from the arch of the aorta, there is a branch for the left side, right? So it's just going all the way up to the head, just in a halfway where you can find the thyroid cartilage. That's the common carotid artery, so it's like this short. And then after that, it bifurcates into the external and internal inside to the head. So the external is short too. So when you trace it, it's gonna be from here all the way just up to the level, and that's it. And from this here is external carotid artery. So to find the pulse, it's same spot for both. You're gonna go lateral to their thyroid cartilage, anterior to the SCM muscle, and deepen your finger. It's always easy to feel their pulse. And then for the external carotid artery, there is the other branch that you need to know, right? First one is the facial artery. So when you locate their anterior border of their masseter muscle, and then you're gonna follow along right by the rib, and then along their nose, and then toward the medial side of their eye. That's the length. From the external carotid artery, it's facial. All the way up here. And finding the pulse is the masseter muscle here, and then there is an inferior border. So you're gonna go at the junction between those two to feel the pulse here. And then once you locate the pulse, you're gonna count the number along 1, 2, 3, 4. Then the examiner will check you whether you're on it or not. Okay. And then the superficial temporal one is from the external carotid artery 2, and it goes to anterior to their ear all the way up, and there is a one branch to the frontal one, the other branch to the parietal. So you're gonna trace it from external, and there's one branch, and to find the pulse, you're gonna go to anterior to their ear, and then you need to find their zygomatic arch, and then the posterior part of it, you can feel the pulse from there. 2, 3, 4. And then, so now it's subclavian, right? So it's starting from the posterior to the SC joint here, and then it drains into, it goes like along down toward the axillary. And once it passes the lateral border of the first rib, it's really short, it's like this, right? And to find the pulse, you need to have your patient to relax toward that side where your fingers are on it, and you're gonna hook your finger posterior to their clavicle with a consent, and then it's easier to feel it. 1, 2, 3, 4. And for the axillary one, it's starting from the lateral border of the rib, and then it goes toward their axillary, and where the lower border of the teres major, it ends there, and then it then changes into the brachial, right? So it's short like this much. And to find the pulse, you need to deepen your finger. So I'm gonna hooking my finger towards the neck of the humerus like that way. With a consent, you can relax your arm. And then once you find it, it's easy to feel the pulse there. And then the brachial one is easy, right? So from the lower border of the teres major is, and then it's lateral to their biceps, goes along down when it reaches to the cubital fossa, and it bifurcates into 2. So tracing it from here all the way down, and it becomes 2. And so find the pulse is like here or like here, wherever you feel comfortable to find it. This will work, alright? And for these two, can I slide it right here? So in the cubital fossa, there is a 2, goes like this way, right? So the ulnar one from the brachial artery goes all the way down to their fingers, and then finding the pulse is easier when you find the tendon first. This is the tendon of the flexor carpi ulnaris, and you're gonna slide your finger laterally from it, and you can feel the pulse there. And for the radial one, from the brachial artery all the way down to all the way finger, and then you can find the tendon of the flexor carpi radialis tendon, and you're gonna move slide laterally from there, feel the pulse. Sorry. And then that's it. And then you need to know how to trace the veins too, right? So the basilic vein, you're gonna start from the back of the hand, and then it goes anteriorly, lying down, and then medial line of the arm, and it drains into the axillary vein, but more the proximal part of it. So the cephalic one is starting from the back of the hand, winding anteriorly, and goes all the way up, and it drains into more the proximal part of the axillary vein. And there is an external jugular vein that you guys need to know. It's the same kind of the way, but different direction because it's coming from here and drain into the subclavian vein here. So like a common carotid, external carotid goes up, but the external jugular is coming from here and then going down drain to here. So these are the one that basically you guys need to know. For the occipital one is occipital artery is on the back of their head actually, and then it goes toward the back of the head, and then finding the purse is gonna be easier when you locate the mastoid process and goes a little bit closer to it. Then you can find the purse actually. Occipital. But on the list, there are some of them is not on the list, so then don't worry about it. Like from the list that I gave you, that's the thing that you will be asked for the MSEC this exam, and then the MOCOP. But MOCOP for the artery, just the artery, like no vein. But this exam you will be asked veins.
So